Hello friends, welcome into the Guess the Remedy. So question is, a middle-aged man comes to me for his complaints of coryza with blockage of nose, and his nose especially getting blocked in the night time. And what he said, doctor, I feel because rainy weather has started, rains are there, I am not able to go out and do my exercise. And because of rain is there out, I am not going to exercise, I am just sitting at home. And I think my all these complaints coryza started because of this. So what remedy we will prescribe to this patient? And the options are Rustox, Sapia, Dulcamara or ammonium carb. Okay. So when you see this case, a very short case, right? In rainy weather, rainy days, we encounter such cases very frequently, cold, coryza, cough, right? Simple cases. So how to prescribe in this case? So whenever we see such kind of case, rainy weather has started, right? And rain is the cause, immediately we think of Rustox. Because in Rustox, we know there is elements from getting wet, right? Elements from rainy, damp, wet weather. Okay. And one more elements in Rustox is getting cold when overheated. Right? So rainy weather is there. And what he is saying, I am not able to go to exercise, and because of that maybe I am suffering. So in rust talks what we see, rest, aggravation, exercise, amelioration. So here anybody can easily think of rust talks, right? But in rust talks, the main affinity is not the mucous membranes, is not the nose. Main affinity is musculoskeletal systems. It affects the muscles. So whenever rust talks patient comes in acute, I expect there has to be some body ache, there has to be some backache, muscular pain with the symptoms, which is not there in our case. Okay. Next option is Sapia, right? And when you see Sapia, Sapia is well known as washerwoman's remedy. Okay. So Sapia gets aggravated because of working in water, because of getting wet in rain. And in Sapia also, if you see the aggravation, okay, so is there when you are not doing anything, and amelioration is by doing violent exercise, by dancing. So here it looks like coming close to Rustox, and with our patient, because our patient is also saying I am not able to do exercise, I am sitting at home. But when you see Sapia, yes, Sapia has getting wet in aggravation or working in water especially aggravation, but Sapia's amelioration is violent exercise, dancing, right? And when you say dancing, dancing is a very vigorous physical activity, there will be rhythm, okay, like Zumba. So all these violent activities will ameliorate Sapia, and our patient is saying my daily exercise, morning walk, right? So he goes to morning walk in the every day and he feels better, that has stopped, he's not active. Okay. And the affection of Sapia, like Rustox, what we saw, Rustox affects the musculoskeletal system. In Sapia, main pathology, main tendency is laxity. Laxity of the system, laxity of muscles, laxity at the mind level, right? Laxity at the circulation level. Okay. And because of that laxity, we see there will be slowness, there will be loose muscles, right? There will be dullness, which is not there in our patient. So Sapia looks like comes close because of modalities and maybe rainy weather, but if you go in detail, then Sapia does not fit with the case. Okay. Then Dulcamara. So now in Dulcamara, as we know, Dulcamara gets affected by rainy, damp, wet weather, cold air, cold, wet air, right? So Dulcamara can be the choice, and the affinity of Dulcamara is mucous membranes, right? Here the nose is affected, so Dulcamara has affinity of nose, mucous, respiratory mucous membranes. So Dulcamara can fit with the case, right? But in Dulcamara, always remember, whenever there is exposure to damp, cold air and person develops cold coryza, that nasal discharge has to be very profuse excessive discharges, or it is called as weeping coryza. So much discharges are going. If you read Boric, open the Boric and read Boric's first paragraph. Boric says catarrhal affections of mucous membrane, there has to be excessive discharge. From all mucous membranes of Dulcamara, there will be excessive discharge. So for Dulcamara patient, if patient is having coryza, that profuseness of the discharge has to be the main troubling thing for the Dulcamara. Okay. And in Dulcamara, we don't see that kind of modalities like I'm going out, doing my regular walk, feeling better, right? So these kind of modalities we don't see in Dulcamara. So Dulcamara comes close, but not the exact remedy. And then what remains? That will be your remedy, right? Yes. And last is ammonium carb, but it is not only because about 3 are not fitting, so ammonium carb. So when you see ammonium carb is very good remedy having action on respiratory mucous membranes. Okay. And how ammonium carbs get affected, how all complaints starts. If you open Allen's keynote and read first 2-3 lines, you will get what Allen's write. The sedentary lifestyle, the sedentary habits are responsible for all complaints. Okay. And when you see what our patient is saying, because of rains, I am not able to go to do my regular exercise, my regular morning walk. I am not able to do that morning walk. I am not able to go out. And because of that, what's happening? I am just sitting at home doing nothing. So he is developing a sedentary habit, sedentary kind of lifestyle. And after that, he developed the coryza. So this is the course how this is developed. And if you see ammonium carb, Fatak or Boric, if you see, the main modality of ammonium carb is getting aggravated by cold air, exposure to rainy, damp, cold weather, and it affects the nose. Especially it causes the obstruction of nose, and our patient complaint is coryza with obstruction of nose, especially night. Okay, he is not giving exact time of night, but if you read ammonium carb, the specific time of obstruction is 3 a.m. And especially overall, if you see ammonium carb, obstruction in ammonium carb gets aggravated in night, is one of the main remedy in nasal obstruction at the night time, especially 3 a.m. And I remember I had one patient, he used to develop lot of nasal obstruction, right? He was having allergic rhinitis and nasal obstruction in the night, especially around 3 a.m. And what that person said, doctor, I get obstruction and my sleep get disturbed exactly at 3 a.m. Right? Nowadays, I don't bother to see watch also, right? So whenever I get up because of nose obstruction in the night, I know it's 3 a.m. And if I go and see the time, it will be 3 a.m. So this much aggravation, precise aggravation ammonium carb has. Okay, but that was the different patient. But I learned from that patient, ammonium carb has obstruction of nose, especially at night time. Okay, and especially 3 a.m. And the main complaint starts because of sedentary lifestyle, doing nothing, just sitting. And in our patient, the cause of coryza is this sedentary life. Because of rains, he is not going out, and obstruction and night aggravation. So I prescribed ammonium carb to this patient. So this is how subtly we have to differentiate the close coming remedies and prescribe in our case. Thank you.